Welcome to Building Something Admirable, the podcast that takes you behind the scenes of how to start a healthcare-related business. I'll share each step that we took to establish our now thriving practice at Meyer Medical, including our highs and lows, insider advice, and real-life lessons in every episode. Good evening, budding medical entrepreneurs. This is Alex for the Building Something Admirable podcast. Haven't recorded one of these in a few days. Had a interesting update with the discussion regarding my resignation at the hospital. I thought this was a perfect time to record another one. So, let's begin. Alrighty. Well, I will be uploading these without the same lag in between, so it probably won't feel as out of the blue as it does to me right now recording this. But even so, I will give a little summary for someone tuning in kind of right now. Basically, is it becoming untenable to maintain my job at the hospital and at the practice? And for a couple reasons, I had to choose the practice. I mean, the main one being that we have multiple people whose livelihood depends on it. Whereas my absence from the hospital, well, a huge bummer for myself because I really enjoy, some of the, a lot of the aspects of working there, and my, great relationships with my coworkers and all that stuff. And despite that, obviously had to choose the practice in this case. And as I mentioned in a prior episode, discovered that right around the same time that I'd put in mine, my resignation, my co-medical director team here, he put in his as well, which involves him and another physician leaving, trying to keep this vague just for privacy's sake and stuff. Which means that all of a sudden the hospital is in a situation where they don't have the opportunity to easily fill the gaps in the physician staff. It is very hard to recruit physicians, and it's extremely hard to recruit 3. Now, in doing so, they were going to have to possibly make arrangements that would closely align them with another group, for better or worse. And there are pros and cons to that kind of relationship, but does put them in a weak negotiating position, especially if anything ever changes with that group and they want to exercise their influence here. Well, having all the physician staff by that means they can get where that's going. So during this whole thing, I was true to my word. We weren't leaving because of anything besides the economics. Well, sorry. The vast majority of the reasoning was the economics of the whole thing. So the solution to this was going to be finding a way to minimize the amount of wasted time at the hospital where I'm not doing the doctory stuff and spending too much time doing the stupid BS paperwork stuff that doesn't benefit anybody except for us finally getting paid for the work we've done because insurance, that thing too. So a big solution would be finding a system so that we can reduce the call schedule burden on me and Angela. That is kind of step number 1 in relieving some of our time burden here and allowing us to focus more on patient care and then all of our obligations at Meyer. So I've been pushing that for like 9 months. I've been saying that this is one thing that I was really unhappy about because when I first signed a contract, there was no call for the physiatry staff, the rehab doctors. and upon arrival found that situation had changed at the behest of someone higher up than our level, with whom I have had some indirect conflict due to differences in philosophy, we'll say. I regard myself as ideally unpretentious when it comes to my role as a physician, while others see this still as a moral whatever. So, I said that there's no reason we have to be taking a call, and that's not necessarily a physician matter, and some of our things that we are forced to do don't need to be handled by physicians, and yet this individual, from my understanding, put a little pressure and said that physiatrists should be more involved, and yada yada yada, more call and some other stuff. And despite my concerns and despite my frustrations with this, after 9 or 10 months, nothing had changed, and didn't look like it was going to change, and so that was a big factor in my time issues, and deciding to, pull out for the sake of admiring. Okay, you're caught up now. Well, it looks like forced to change caused some of the administrators at the hospital to actually change, and they looked into it and found a way to provide call services that then offload their staff. I've been saying for months that this is not only a direct benefit for us, but also them and local other locations of them when they're trying to recruit physicians, because new rehab docs don't want to take a call anymore. It is just not necessary. It's more of a medical issue anyway. So internists, I'm not saying that they should be the ones that do it just because they're internists, but it's really kind of more of a medical thing. There's no rehab related problems that can happen overnight. It's the medical things that happen in rehab. So they appear to have found a group that will take the call burden off of us, and now I'm back at the table. I'm willing to negotiate. So that's kind of where we are right now, is trying to find a way to offload some of the residual issues. Now, the main one is just because of the work demands that are involved with documentation and call and all that stuff. Our revenue, our time has been limited, and right now most of our revenue is derived from time, just billings. So even though the goal is to have alternative revenue streams that will allow us to live without constant billing and reimbursement, we're not there yet. So that's my next point. So when we go into negotiations tomorrow, or start the renegotiations, because we already started and it kind of fell apart after the increased salary offer, but it wasn't enough to cover the other stuff. So when we go back into the negotiations tomorrow, I'm going to be like, listen, you solved the big problem with the call thing. Now the days that I'm on call, I'm actually really just doing pre-screens to select who's appropriate for rehab and who's not, and that's it. So no longer is it really a factor of doing extensive prep of the new admissions. We'll have to do power plans for admission orders and that kind of thing, which isn't a big deal. But the really annoying stuff, which is the medication reconciliations that depend on the sequence of other people doing their jobs in a timely manner, no longer falls on me and Angela. And so because of that now, call days really just have, an hour total of extra time involved, which is actually a lot less. And that's something I can manage. But, like I said, the finances are the other part of the issue. So, if we can't create more time in a day, the other solution is going to be my own money. So, that is my second part of the negotiation. It's a lot easier. Here's a big pro tip. It's a lot easier in negotiations to ask for a larger lump sum of money than a lower increase in something that's recurring. In other words, we got a pretty good increase in the salary, which I'm not, turning my nose up on. However, it just frankly wasn't enough. So instead of asking them to go even higher on that, I'm going to come back and say, listen, our finances aren't terrible, but they're tight. And if you're able to turn around and give us some breathing room here with a one-time payment in the same way that I got a signing bonus, a year and a half ago, if you can hook me up with a re-signing bonus right now, I am, we're there. We're done. The rest of the problems we can solve with our, breathing room now and our finances. And I already have a solution for that one too. We've been looking to hire this extremely talented nurse who currently works at the hospital, and is, she's already looking at alternative options. So I feel less guilty about poaching, especially because one of the things that we can do is potentially hire her part-time in the mornings to do some of the scribing duties for me. She's already credentialed there, so she's already, been easy solution to get passed through corporate again. But it'll also mean that she can stay there for the other half of the time. And so they're not going to lose her entirely. They're going to just lose mornings, but she's still kind of involved in the day-to-day. So it again solves a lot of problems and keeps someone that is fantastic and they love in-house still. And for us it's fantastic because it means that if she's part-time to start, we don't need to worry about benefits and stuff, and we don't need to take a huge leap and hire her full-time when we theoretically can't afford it from the start. Scaling up is going to be a lot easier than this. So if you hire her part-time, oh my goodness, that'd be the win. So with the increase in my salary for the administrative stuff, I basically just funnel that straight to paying her. And with the bonus, I would use that to clear just a lot of debt off of our books. That'll then allow us to not be, running on fumes in the short term, and can fund the supplement and the rest of the book costs, because we're going to be doing audiobook and final stuff. So this is kind of the last part of the plan, and in hindsight is the best way this all kind of worked out. But at the time, it looked like it was kind of very piecemeal. So I've always been a big believer of everything happens for a reason. I am, not knocking religion, but I've never really been hugely religious in my adult years. But this is one of those things that just kind of oddly fell into place perfectly, as if something was guiding it along. But either way, that's where we are now. I thought it'd be worth discussing because, again, it goes back to the core negotiation aspect of things, especially when you're doing kind of the arrangement that I have, which is part of the part of your practice is kind of contracted out to a larger entity, and then you have that as the foundation for the rest of the practice. So to be continued, but I appreciate you watching this one. If you have anything specific you want to know about the situation, please comment below. If you found this helpful, please like and share with other people in similar situations, because the exposure of this is what helps us get more of an audience and be able to put more time to these things, and eventually offload some of the revenue burden from billings, and will only allow us to have more time for this kind of stuff. So it kind of feeds forward that way. But I appreciate you watching, and talk to you next time. Thanks. Best of luck in your business. Stay tuned for more insider advice on building something admirable. Don't forget to like, share, and subscribe below.